Hi, my name is Dr. Jenny Seawell. I'm a pediatrician at Premier Medical Group. Today we're going to talk about viruses. It is about time for school to start, and I know we are all looking forward to our kiddos coming home with that first little bug. During the summertime, it's really easy to kind of give our kids a few days to get over a little bug and see if they shake it off on their own. But once school starts, the school usually will need a school note, and sometimes we get a little nervous about when do we need to bring them in. The last thing that we usually want to hear is it's a virus. But viruses are the most common cause of many pediatric illnesses. One of the things that I will hear both on social media and in the room is, "So, you don't know what it is then?" Actually, yes, we can know what it is. There are about a gazillion different viruses, and sometimes knowing exactly which one it is doesn't make that much of a difference. Whether you have a rhinovirus or coronavirus doesn't necessarily matter if it's not going to change how we treat it. Often there are specific clues on how your child is presenting, whether or not it's red eyes, a cough that persists, certain rashes, that will help narrow down into the type of virus that we are dealing with. Also, whatever is going on in the community at that time. Many times, the big offenders change by season. We see some viruses more commonly in the spring, some more commonly in the summer. In general, it is much preferred to order expensive tests only when the answer will change how we approach your child's management. There are many things we can do to help our children to be more comfortable when they have a virus. Tylenol and ibuprofen can help bring down a fever. All medicines can be harmful if given in the wrong doses though, so please be sure to check with your pediatrician before dosing your child. Saline spray is very helpful for breaking down nasal congestion, decreases the swelling in the tissues inside of your nose, and actually loosens up the mucus, making it drain more easily. Honey will help a cough, often much better than over-the-counter cough and cold preparations will. It is not safe in children under a year of age, but for your older children, it can be very helpful in soothing a cough. Sometimes time and patience is the best medicine. Antibiotics do not treat viruses. They are only helpful for treating bacterial infections. Antibiotics are also not without side effects. Some children will develop allergies even if they've never had an allergic reaction with that antibiotic previously. And many children have stomach irritation with antibiotics, leading to diarrhea and sometimes vomiting, stomach complaints. We try not to add any antibiotics unless it's actually going to improve your situation. Unfortunately, there's no way to predict if your child is going to have a secondary infection or not. So in general, if your kiddo's having that fever that's lasting past 5 days or they're not starting to improve, it's time to get back in and check them out and see if there's something else going on. It's very easy to be worried as parents. Sometimes our kids get sick, sometimes things can be serious. A lot of times it's just a virus. Remember, sometimes the best medicine doesn't come with a prescription.